Welcome back. In today's session, we will discuss about a homeopathic remedy called Malandrinum. So we see it is grease in horse. You can see the Malandrinum. It is prepared from the grease in horse. It is a very effectual protection against smallpox. So Malandrinum gives a protection, effectual protection against the smallpox. It is used in cases of ill effects of vaccination. So we have the cases wherein the ill effects begin after the vaccination. Post vaccination, there are certain ill effects like we have skin rashes or diarrhea. So the ill effects which are occurring after the vaccination, Malandrinum is indicated. The other remedies are Tuja and Silesia. It is also efficacious in clearing out the remnants of cancerous deposits. So, if a person has cancer and certain cancerous deposits are still left over, to clear out these remnants of the cancerous deposits, okay, these are cancerous deposits, the remnants. So, in order to clear out these cancerous deposits, the remnants of these cancerous deposits, Malandrinum is indicated. The most important sphere of action of Malandrinum is on the skin, and the skin is very important from the exam point of view. It can be asked for 3 or 5 marks. So, we will focus on the part that is skin in Malandrinum, beginning with a scab on the upper lip. So, we have in Malandrinum scab. You can see in the picture here the scabs on the upper lip. There is stinging pain when it is torn off. When they remove the scab, when it is peeled off, there is a very bad stinging pain when the scab is torn off. Okay, you remember, guys, the first thing is what will you mention under skin? First, you have to remember in Malandrinum the scab. Okay, the scab is on the upper lip. When it is torn off, there is a sharp stinging pain. Okay, stinging pain when the scab is torn off. There is aching pain in forehead, dry scaly itching ragates on the hands and feet in cold weather and from washing. So when the patient is in cold weather, on exposure to the cold weather and in from washing, there are dry, scaly, and itchy ragates. These ragates are found on the hands and the feet of the patient. Clear, guys? These ragates are found on the hands and feet of the patient. We have also aching in the forehead. This you can add on, but it's better you don't write it under skin. So we have this dry, scaly, itchy eruptions. The dry, scaly, itchy eruptions, ragates on the hands, feet in the cold weather and from washing. The toes will feel scalded and they itch terribly. You see the toes, they also feel scalded, okay, scalded, and they will itch terribly. Bone-like protuberances. You can see in the picture here, there is a bone-like protuberances in the feet. So you can see the bone-like protuberance. Clear, guys? So what did we see now in the skin? We had the first thing, scab. The scab on the upper lip. We had, okay, what's wrong with this? Just a second. Yeah, cancel. Fine. So we have this scab on the upper lip, ragates which were found on the hands and the feet. They were scaly, itchy. Then the toes will feel scalded. They are also terribly itchy. Bone-like protuberances. Smallpox, measles as a preventive. Like in we saw, it is used as a protection against the smallpox. Similarly, it also gives as a preventive medicine. It is used as a preventive in cases of measles. Moving further, we have impetigo. So the impetigo is covering the back of the head and it is extending over to the buttock and even into the vagina, which is covering the labia. So guys, we are studying about impetigo. You can see the impetigo, it first starts on the back of the head, okay? It is first starting on the back of the head. So it starts on the back of the head, then it goes to the buttocks, okay? It starts on the back of the head, going to the buttocks, and even it. So in the females, we have impetigo is also found in the vagina, which is covering the labia. Okay. Impetigo is also seen on the extensors of the forearm. You can see it is also found on the extensors of the forearm. Boils, which are, and also the malignant pustules. In cases of boils, in cases of malignant pustules, Malandrinum can be thought of. What are the skin indications we are studying? So guys, we are studying about the skin of Malandrinum, wherein we saw impetigo. In the point impetigo, what are you going to mention? It will start at the back of the head, then to the buttocks, and it is if it is found in the vagina, it is covering the labia. Okay, and then it is found on the extensor surfaces of the forearm. We also have boils, malignant pustules. It is given in the bad effects of vaccination. What are the bad effect of vaccination we had? The dry, harsh skin. Okay, the dry, harsh skin post vaccination. If it occurs, then Malandrinum can be thought of. The small dusky red spots. You can see the small dusky red spots on the leg, and these red spots do not disappear on pressure. Like in typhoid fever, petechial typhus, we have these spots. So these small reddish spots on the leg, even on pressure, these spots do not disappear. Okay, you're applying a pressure, and even on this application of the pressure, these spots are not disappearing. Clear, guys? Dry, rough, unhealthy skin which is remaining for years after vaccination. So we saw this point. There is dry, rough and unhealthy skin which is remaining for the years long after the vaccination, post vaccination. Bad effect, ill effect of vaccination. Adre medivostuja and silesia. We also have the skin which is very greasy. Oily eruptions on the skin and hair is excessively oily. So in Malandrinum, we have this skin which is very greasy, oily skin, oily hair, oily eruptions. Next we have eczema. Clear, guys? Next we go to eczema. Eczema of the face. You can see here there is eczema of the face. We also have eczema on the scalp with burning, stinging, itching. What is the character here, guys? In Malandrinum, we have burning, stinging and itching. So we studied in the scab, when the scab is torn off, there is a stinging pain, burning, itching. So we also saw the extensors of the toes. They will extensors of the limbs and the toes, they will itch terribly. Pustules are very slow to develop, but they are never ending. As one healed, another will appear. So these pustules, you can see in the patients, they have these pustules which are very slow to develop. You can see they will slowly develop, but they will never heal, because as soon as one disappears, the other one appears. So you can see this is almost disappearing and the other one appeared. So the pustules are slow to develop, but they are never ending. As one healed, the another will appear. There is a sensation of rawness of the skin. The rawness sensation is found over the chest and also on the shoulders after bathing, as the skin has become scraped with burning, acid, smarting by covering the parts. So guys, you can see here in the picture, there is rawness sensation on the chest and shoulders. And you can see the shoulder here, it's all reddish. There is raw sensation on the shoulder. And after bathing, as if the skin has been scraped. They feel as if their skin has been scraped. Most of us will have experienced this symptom one or the other time. After bathing, the skin feels as if it is scraped. But here the intensity will vary. There is burning, acid, smarting by covering the part. So after the shower, if the patient covers the part, there is burning, acid and smarting when the part is covered. Clear, guys? What did we study? There is rawness of the part. You can see there is rawness of the part on the skin of the, it is seen on the skin of the chest and on the skin of the shoulders. And after bathing, they feel as if their skin is scraped. And there is burning, smarting, and we also have acidic burning, smarting of the covering parts. There is a burning, itching sensation. So, three sensations so far we saw: burning, itching, and we also have stinging. Okay. So, it is seen beneath the skin in the palm of the hand. It appeared upon contact. After the eruption has disappeared, it continues for several weeks. So you can see here, once the eruptions have occurred on the skin, so we had eruptions on the skin. Once the eruptions have disappeared, this itching remains for very long years after the eruptions have disappeared, for the several weeks, sorry. So there is a burning, itching sensation beneath the skin. It is seen in the palms of the hand. It is appeared after contact. After the eruption has disappeared, it is continuing for several weeks. So this was all about the skin symptoms of Malandrinum. I hope it is clear, and if you have any doubts, put it in the comment section. And if you like the video, don't forget to hit the like button and subscribe.